Hi, how are you? So in this video, I'm sort of telling a bit of a tale about some of the issues that I think are important within the NHS generally. I'm starting off to illustrate some points about language. So I thought I'd also talk about some of the language that I use and why I think that's important. So there's a little bit of an explainer at the start. And then I'm going to talk about language erasure within the NHS. Then I'm going to explain some points about data and structure and how trans activism has penetrated the way that the NHS operates. Then I'm going to talk briefly about same-sex care, and then I'm going to pick that up in the next video where I come back to looking at the issue of disability care in terms of home care, and why it's important to women specifically. I do make some mention about the Gender Recognition Act and give some explainers about that, and people who've got gender recognition certificates. And, you know, I obviously, if you know some of the other stuff I'm working on, it's about why I think that we need to repeal the Gender Recognition Act. So I hope you enjoy. As a kind of sidebar, and some of my thoughts about why I don't always make comment in my videos, you know, when people use the language of trans people, etc., and why I don't sort of interject or disagree with them. I mean, there's kind of two reasons for that, really. I guess that, you know, when I'm talking to them, that video is really about them and their views and their beliefs and their story. So that's the kind of point of the chat. And I don't really want to deviate down side alleys because my input at that point isn't really relevant. And the other thing is to think about it in terms of kind of my bigger set of beliefs about and where I'm coming from, because remember, I'm coming at it from a public health perspective, and so I believe that we're in the middle of a sort of pandemic of transgenderism and gender ideology. And obviously, as a public health academic, I'm interested in the root cause of things, and the study of disease and population at a population level, and the behavioural epidemiology and sort of global burden of healthcare issues. And I guess how things evolve within populations. And in this instance, obviously, that relates to a kind of systematic social change and how that's come about and manufactured this huge social pandemic of iatrogenic harms, essentially, while investors are making huge amounts of money from human suffering. And so I'm coming at this from a population level. And so I'm interested in, you know, research methodologies and social inequality drivers in terms of health and globalization, and the political influences. And so I don't really believe in the foundational tenets of gender ideology. And so it necessarily follows then that I don't believe in the language in any different shape or form. And so I very much hold the line that it's a religion that's being sold and that people are sort of caught up in it. And obviously, along the way, there are various people who have paraphilias engaging and swept along. And then there's obviously the sort of tenets of queer theory as well. And fundamentally, I'm interested in you know, the evidence base, as I said, and rigorous critical analysis. And what we do know, and hopefully I'm sort of trying to, you know, make really, really simple, is that the evidence base is a nonsense and is wholly corrupted by a whole load of unscientific assertions. And so the whole kind of house of cards of gender ideology is, you know, I find it completely wanting. And so I guess, I don't know if that's helpful or not, but really, I guess that's me explaining why I don't, you know, if people talk about trans people, etc., I kind of, you know, that's their prerogative, etc. So the second part I thought I'd just jump into a little bit was about the issues of language erasure generally and how that relates to the NHS as you might experience it as a patient. And I know that it's something which is incredibly upsetting and important just to sort of touch base upon. So, I mean, you may or may not be aware about the erasure of the word woman from NHS language, but it's certainly been something which has come to the fore in the last couple of years. And I'll find a couple of images and campaigns to bang up to show you, because certainly they've not done the same for men. It's definitely been about the female side. And one of the very telling signs was that in September 2021, The Lancet, which is a very, was a respected medical journal, ran with a headline in one of its articles, which basically said, historically, the anatomy and physiology of bodies with vaginas, I think it said, have been neglected. And you may not be shocked to know that that caused a huge amount of upset and outcry. In many different trusts, they've been pushing incredibly hard for the words woman, mothers, and breastfeeding to be changed into being more gender neutral. And so you find this is all about, in deference to the practices of gender ideology, this religion. If you think about this in relation to maternity care, this is particularly egregious because this population of women, and I've had 3 children myself, you're particularly vulnerable at that time. And let's bear in mind that, women die through obstetric violence. They suffer from postpartum psychosis and postpartum depression, suicide and injury, as well as general difficulties adjusting to motherhood and learning to breastfeed. It's an incredibly emotional time with all of your sort of hormones cascading through your body, and learning to cope with this new situation that you're in. It places huge demands on you, and the last thing that you really need is to feel this emotional erasure by becoming a chest feeder or a woman with a cervix, a person with a cervix, etc. And we have this, a long-standing plethora of studies which within the NHS, which has highlighted the importance of language, particularly in relation to cervical screening, and how little women actually know about their anatomy, and that clear language has been an important part of prevention strategies in order to bring women into prevention services for screening. And also, let's remember that a lot of women, English is going to be perhaps their second language, and they may be new to the UK. And it's even more important that they have very clear campaigns that illustrate that this message relates to them. This article that was in the Mail in February 2023 basically said the Health Secretary was going to intervene about a report that had been pushed out around the NHS, which basically said Barclay orders urgent investigation into woke NHS guidelines telling staff not to use he or she. More stuff about being, inclusive communication, but basically erasing the identities, the gendered identities of males and females, instructing doctors and nurses not to use phrases such as Mr., Mrs., he and she until a patient had confirmed their gender identity. And everything generally always leads back to this guy, Dr. Michael Brady, who's the National Advisor for LGBT Health at NHS England. You can generally assume that things are going to have his name written all over them. And I'll put up some screenshots to give you some examples of some of the shenanigans that are in this report. I know that midwives in Brighton have been really keen pushing a lot of this move towards gender inclusive language and chest feeding, and come under very harsh criticism for it, quite rightly so. I know that the charity Sands came under some very harsh criticism when they removed the word woman. They're a baby loss charity, and they supplemented it for birthing parent. And women, rightly, on Twitter were absolutely enraged by this, and it triggered all sorts of different pain for them. So I guess the key is, when you're experiencing the NHS, in all of its forms, push back. You know, if you're being asked to fill in these forms, which you have a whole host of different facets of gender ideology that you don't want to take part in, tell them that you are a non-believer in this religion, and actually you feel it, like Denise said in one of the other videos, she finds it an actual moral injury when, as a gender critical person, she's being forced to comply with this, because you also can find yourself in a situation where you can't actually progress in automated systems until you enter your pronouns. I certainly found that myself recently when I was doing an online physio appointment form, and I had to put pronouns in because I actually couldn't go further until I did. And it genuinely really annoyed me to have to play the game with this pronoun nonsense. So a little bit about language. So I think it's important to look at data and structure in order to illustrate what it is I want to talk about. And I've got some really important information that I want to share with you. So in terms of policy and practice and clinical care, trans rights lobbyists have managed to embed themselves right across the NHS system. And obviously some of you may have already noticed this. Why is the corruption of hospital data so fundamentally important? Well, basically because the words sex and gender are not interchangeable. Sex relates to our biological bodies, and the word gender relates to social construct, despite the fact that you'll find in many, many different walks of life that organisations are using the word gender and they're monitoring data collection using that word rather irritatingly. Now, the only thing that is really, really fundamentally important to any clinician is the issue of sex. And remember that this is wildly misunderstood by trans rights activism, because they seem to believe still that if they take some cross-sex hormones, that they will actually be changing their biological sex. But they're also allowing patients to self-identify. They're also allowing patients to erase their biological sex and to have a completely new set of notes set up for them, and they can completely and utterly erase all history of previous name, medical history, and become a new person. This is entirely problematic for the following reasons. Taking cross-sex hormones in whatever format you fancy, none of this changes the fact that your heart, lungs, internal organs remain exactly the same. And the easiest way that I can illustrate to you is in the format of some of these images that I'm going to show you. So potentially here, what we have is respiratory ventilation, cardiac perfusion, renal dialysis, maybe, you know, neurological shunts, 101 different syringe drivers and drips, all carefully titrated by those nurses based on the minute observations and careful mathematical calculations, all of which are based on your sexed body, as well as your size, and all of them come down to the fact that you are male and female, because males and females have completely different blood values, and this is of fundamental importance, right? So your sex of origin remains vital. Now, if you can, for a moment, imagine the amount of work that goes into maintaining a patient's well-being, that those nurses are doing on a daily basis. You can possibly imagine how irate and stressed I feel every time I see someone on Twitter talking about their fantasy of being put in a comfy little side room because their gender identity feels may get slightly hurt if they're put into a hospital setting, when I'm thinking, look, if you're in a hospital environment, the reason that you're there is because you're clearly very, very unwell, and you're there because you need observation, intervention, and clinical input. None of the external changes that you can do to your body by sticking bits on and chopping bits off, or growing bits of hair, or removing bits of hair, are going to make any changes to the fact that fundamentally all of these biological factors are really, really important, and you may die if you're not going to disclose your sex of origin. And because this is an entirely optional issue, or say you're rushed into hospital unconscious, as are many of the patients who end up in this ITU situation, and obviously none of your previous history is going to be recorded in your notes unless you actually asked for it to be recorded. Then this could be a serious life-threatening issue for you. There are different laboratory blood values between men and women, and so if we use the wrong blood values, then that can lead to the wrong drug regimens, and so you may have over-treatment or under-treatment, and because your sex of origin is self-reported, then a patient can or cannot tell the clinician their sex, depending on how they fancy it. Peak flow is different in men and women. Catheterizing is different. Cancer screening is different. Even bone health is different. If the patient's on these hormones, then obviously their risk for fractures is going to be different. So fundamentally, sex is important. So rather than keep sex recorded on hospital records and add in gender identities, 101 gender identities, what trans rights activists did was they forced the change so that sex has been removed and dropped in many situations. So they're not even recording it. And the NHS is essentially fundamentally got a smorgasbord now of self-ID. So this is affecting the safety, diagnosis, treatment, scientific and basically clinical research abilities, as well as the public health screening and treatment across the whole setup, because it's going to affect the data outputs, because periodically we rely on this data in order not only for funding, but in terms of research methodologies. All of this relates to we absolutely fundamentally needs this clear record keeping. So one of the things I want to jump straight into, right, is children safeguarding, because if you can change your notes willy-nilly, you can change a child's sex marker. And I want you to put your children's safeguarding hat on and think about the impact of this, right? Because this is stratospheric. This is massively important. So put in your mind, what happens to kids if you have the ability to change their sex marker, okay? So I want you to think about the issue of trans housing by proxy parents, okay, the trans child concept, and the ability for adults to jump around hospital trusts. Because essentially, if I can take my child, right, and I can say, right, my son is now my daughter. They have been playing with the wrong toys. They really, really like wearing those other sets of clothes. They've always been this way. And I fundamentally believe that they are a trans child. And so we've actually going to change their name. And I want you to go forward and affirm their identity. And invariably what you'll find is that because of the capture of the NHS, they will absolutely be welcomed in that. And you can now change their hospital records. You can crack on and get their name changed, and you can then delete their previous history and get a new set of notes. So what does that mean? It means, right, that it's opening up an abuse charter, okay? Because it means that parents can then shop around, doesn't it? It means that they can potentially erase a backstory by creating a fictitious set of notes. It erases the principles of safeguarding. It's also opens up doors for the potential, should it be people want to do it. And of course, if you open a door, this is the whole premise of safeguarding. It's an open door for child trafficking, isn't it? Right? Because that's how safeguarding works. It's about if doors are open, then opportunists will go through open doors, right? So I want you to file that into your memory banks just to start with, okay? So the other thing about going back to my issue and what I said to you about the importance of biological sex, I want you to think about the issue of records being fictitious from a medical point of view and the medical impact on that child. Now, we don't willy-nilly ask to see people's genitals and inspect them, right? Despite the fact that many trans rights activists on Twitter's would think that that is the case. So if a child turns up in A&E or at a GP and said they have a particular problem and it's a child who's actually the opposite sex, then things are going to be missed. So they may go down the wrong road clinically. So they might not ask for a pregnancy test, for an example, or they may have a testicular torsion, which is missed because the child's actually noted down as being a girl. Or, you know, a neurodevelopmental test may not be ordered because actually it's not, they're sex specific. And they're, you know, hanging out in the other sex because their records have been changed. They also may routinely be put in younger children's sex hospital wards. They are mixed sex environments, but when they become teenagers, they're sex specific. So you may have, say you've got a girl who's been sexually assaulted, who's hanging out under the umbrella of being a boy, who then gets put on a boys' ward, who is, you know, further traumatized. The other thing, obviously, and you'll know if you know if you're a parent of and you've had young children, you have your little red book, don't you? Male and female children are plotted differently and expected to grow at different times. Similarly, that's going to be missed if the child is inhabiting and hanging out under another sexed umbrella. Let's talk about same-sex care for a moment, and let's talk about it in a number of different contexts. I think that people are still of the illusion that they can ask for and get someone of the same sex to do their cervical smear or their mammogram. Now, obviously, you can ask. In some cases, you might get one, and that's great. But there is absolutely no reason why you should be able to. And I'm going to tell you why for a number of different reasons. First of all, let's talk about men wearing their fetish to work. Let's talk about policies first. Let's start with the staff. A number of different trusts and environments, such as the ambulance service environment, have got trans gender policies in place in order to protect their staff from harassment, discrimination, as per Equality Act, a protected characteristic of gender reassignment. The protected characteristic jumps into play as soon as you say that you have any thoughts, intention of claiming the protected characteristic. Okay, so you don't actually have to do anything in order to claim it. So I could, at this moment, say, you know, I have the intention to transition to be a male. I am a man. I therefore am protected under that protected characteristic. I am a man. You must, you know, you must call me one. If you don't call me one, you're, you know, I'm going to report you for hate criming me, basically. And if I'm in a work environment and you continuously misgender me, and I feel that that's, you know, an egregious, non-accidental issue, then I'm definitely going to be seeking compensation for discrimination, and I'm going to be down visiting HR. Now, this means that this person is operating in situ, and I've literally recorded this section. I can't tell you how many times because I keep saying the pronoun that I want to say. So they are operating in situ and coming, you know, providing care and seen as a female. Similarly, this other person is also operating in situ as a female, in another role in clinical practice and protected under the this protected characteristic of gender reassignment. Now you can go through and search out your own local trust policy if you want, or you can go through national type of policies. This one's the National Ambulance LGBT Network, written by one guy who's managed to change the whole setup essentially. So the bottom line of these things, particularly in relation to the non-binary concept, is that a non-binary person believes themselves to be neither male nor female. So if I was to turn up looking as I am and said, I am non-binary, the staff in any given trust invariably would now say to me, okay, what ward do you wish to go to? And I could say, I want to go onto the men's, say, urological ward. Likewise, vice versa, a male person could do that and say, I want to, I'm going to be put on the female ward. And this has been a bit embedded right across the estate, the NHS estate. If I put myself in a female patient's shoes, or, in my very aged mother's shoes, and she woke up next to a man in the bed next to her, and she said, there's a man in the bed next to me. The policies state across the NHS trust, look at the tension I'm holding in my hands, but essentially she is tantamount to being a racist, transphobic, bigot. She should be dealt with, if not ejected, because she's hate criming this person in the bed next to her. I just want to mention criminal records checking and the Gender Recognition Act 2004 and how that kind of interacts with that, because what we have is a whole number of people who have gender recognition certificates who are out in the general population, who've effectively erased their pasts and changed their names and their sex in law, and who potentially would be able to get a clean DRB, a criminal records check, because in many cases there are windows which have been created, which, if you're more interested, have a look at a website called Keep Prisons Single Sex, who talk really, really clearly about these safeguarding holes that have been created. There's this particular person called Jessica Winfield who was called Martin Ponting, but basically this person has got a criminal backstory of being in prison as a sexual predator, having raped a couple of girls, underage children, and they were also alleged to have sexually assaulted some women when they were in prison. And when they were in prison, they got a gender recognition certificate, and they were very, very dangerous criminal, and they're now out in the community with a gender recognition certificate as a female under this name. So if you want to look them up, you can probably find some more information about them on Keep Prisons Single Sex, who are a fantastic organisation, who I highly recommend you go and have a look at their website. But the point of my illustration is that there are this issue of being able to erase your criminal past, because in many ways there is this huge loophole being created because of some of the optional nature of reporting aspects of your past. So go and have a look at that website too. Before we had this massive corruption of research by trans rights activism, we had loads and loads of data and written discourse and policy which told us that we had the safety, dignity and privacy of women was of fundamental importance. We knew and still do know that women want intimate care carried out by other women, and that this was really, really important to them. We've got dissenting clinicians are being subjugated and suppressed in this kind of dystopian hell, this suffocation of their freedom of speech, where we've got all this EDI training and these courses bullying and cajoling staff into these schemes where these sort of outcomes will reap these rewards of rainbow lanyards and badges and stuff. There's some kind of visual symbols of alliances to the gods of rainbow, etc. Where, you know, pronoun agnosticism is sort of strongly discouraged. I mean, it's just absolutely ludicrous. So I hope that's of some benefit. And then the next video, I'm going to be talking to Sally, and we're going to look at some of the policies in play and Annex B specifically. So I'll see you on that one.